Yeah, okay. Um, I simply cannot help myself. I saw this morning our GTA public health top official going on about what's going on with this surge in cases and what she proposes we should do to end it. To end it, we're going to stop it in its tracks. So what are her proposals? She's saying that we should keep bars, no patrons inside. She wants to keep no indoor classes in fitness centers. She wants to have people that have gatherings to submit all that data for contact tracing, all that good stuff. And she's going to tell you why all that needs to be done. Because, well, there's a rise in cases, right? There's a rise in cases. Everybody knows that cases are the worst possible thing ever. So let's hear what she thinks needs to be done. What she's asking us to do as individuals.
Finally, I'm also recommending, as much as possible, that individuals only consider leaving their homes for essential activities, such.
I apologize. I have it sped up to 1.25% speed because she talks so slow. It's like droning. I think intentionally, but here we go.
Just work, education, and fitness, to name just a few. What I don't want.
What she doesn't want.
Return to a lockdown like we saw last spring.
She doesn't want to have to enforce all these horrible restrictions on you for something that was completely blown out of proportion. There was unprecedented in management, in public health management of the situation. Death counts, no. Everything else, no. It came out of China. China pumped the crap out of it. Our collective government said, oh, there's nothing to worry about. They're going to the Chinatown, and they're saying, hey, everybody come to Chinatown, support Chinatown. Don't be afraid of Chinese people. Don't be racist. And that's what our people were doing here in Toronto. It was actually hilarious. Like in March. You can go back and look for yourself. But she's telling you now that, what happened is that there was this thing and it caught us off guard and we couldn't do anything about it. And it was just the worst thing that ever happened. It's not true. It's not true. It was a typical season. Then all the numbers show it. I'm going to show you after. But even if that thing, that bump, that panic, all that stuff that happened where a lot of people died, probably through malfeasance in a lot of long-term care homes, which is just, I don't, to wrap your head around that stuff is actually, it eats away at your soul when you think about it, because it was so horrible what happened in those places, presumably. But I'll leave that there. And really, the numbers weren't that far off of a usual flu season. It all seems to have to do with the public health rollout and the way that they handle things. But let's just go into what these public health people think, because she's telling you now that it all had to happen. It was for your own good.
I do not believe that is necessary. My proposals are meant to prevent the conditions that would force a large-scale lockdown. The mayor and the chair of the Board of Health.
They're meant to prevent the conditions that would force a large-scale lock. Now, it would make you, who has assumed power over the entire universe, have to exert more power over the people through your influence of people in government. But none of it was necessary. None of it was necessary. There's no evidence for it. I will show you.
And I will advocate relentlessly for support from the senior levels of government to sustain the sectors and the people affected by these proposed measures. The further steps I propose build logically on those announced by the province and provide for a made-in-Toronto solution.
They build logically on all the insanity that was there before, so not very good foundations.
For the distinct needs of our city. Without quick action to implement further public health measures, there is an acute risk that the virus will continue to spread widely. Which means spread more and further and eventually faster, stressing the healthcare system and further straining Toronto's
tsunami.
Economy.
So it's going to be the disease that strains Toronto's economy, not all the actions that were enforced by our public health officials and government actors. It was the disease. Does anybody know any business that was shut down because there was people falling down on the floor because of COVID? With the exception of long-term care homes. Can anybody tell me any place where, here in the GTA, can you tell me anywhere where there was like this acute danger where, oh my God, everybody's falling down. They're all dying left, right, and center. It's just happening. We can't stop it. Oh my God, they're horrible. Really? Can you show me that? Where? Name a place. Where people dying everywhere. No, it's a lot.
We have seen what happens when the virus gains the upper hand.
Oh, the virus.
Spain has just ordered a partial
We're the virus,
lockdown
by the
of
way,
Madrid.
to this woman. I will show you.
And on the last day of September, the UK reported more than 7,100 new infections for the day and 71 deaths.
Oh my gosh, 71 deaths. That is horrible. Don't look at the demographics. Don't actually try to identify who's dying. But they can tell you, they can say that there was 71 deaths in the UK. And they can blame it on COVID. Why? Loose reporting. And most people don't know that even here in Canada, guess how many people die every single day? We have a lot less people than the UK. Guess how many people die every single day in Canada? Around 780 people. 780 people every single day die from something. You can't pull 100 out of that if you wanted to. If you were gymming with stuff because you had an ulterior motive, couldn't do that? Come on, get your head out of your butt. Pay attention.
Government's chief scientific advisor said the country didn't have the virus under control.
It wasn't under control. The virus, people, was not under control. Let's learn about Eileen de Villa. Who is Eileen de Villa? What does Wikipedia say about Eileen de Villa? She's a Canadian physician, public servant, currently serving as the medical officer of health for the City of Toronto, Ontario, Canada, and formerly as the medical officer of health for the region of Peel. Adjunct professor at the Dalla Lana School of Public Health in the University of Toronto. And she's been overseeing the COVID-19 response. But what do we know about her? Well, she attended Havergal College and then McGill University, where she received her Bachelor of Science degree in Psychology and Women's Studies in 1991. Why is she in public health? Women's Studies? Psychology? Okay. When she graduated, she became an intern at the United Nations. Oh, interesting. Moving to Vienna to work with the UN Industrial Development Organization supporting developing countries. Through that experience, she became interested in international health. What is international health, I wonder? She then received her Master of Health Science degree in Health Promotion at the University of Toronto and continues securing internships through the United Nations, including one with the International Conference on Population and Development. So basically, she's a lady that's learning what's really important for global health, because global health is her big concern. She works for Toronto now, but her main concern is global health. So what is global health? Let's just go ahead. By the way, I will go into that after. So what is the International Conference on Population and Development? The United Nations coordinated an international conference on population and development. That sounds like a smart thing to do, in Cairo, Egypt, September 1994. Its resulting program of action is the steering document for the United Nations Population Fund. These guys really are worried about a lot of stuff. Some 20,000 delegates from various governments, UN agencies, NGOs, and the media gathered for a discussion of a variety of population issues, including immigration, infant mortality, birth control, family planning, the education of women, and protection for women from unsafe abortion services. Well, that all sounds wonderful. The first World Population Conference, organized by the League of Nations and Margaret Sanger, she's an angel, everybody knows that, had been held at La Salle Central in Geneva, Switzerland from the 29th of August to the 3rd of September 1927. It was sponsored, the first World Population Conference sponsored by the United Nations was held in 1954 in Rome, a second in 1965 in Belgrade, Bucharest, Mexico. The conference received considerable media attention due to disputes regarding the assertion of reproductive rights. The Holy See and several predominantly Islamic nations were staunch critics, and U.S. President Bill Clinton received considerable criticism from conservatives for his participation, considering the fact that President Ronald Reagan did not attend or fund the previous conference held in Mexico City in 1984. Well, Reagan's evil. We all know that. But what have they been doing? What's been their plan? What have they been up to? They're transforming our world with the Agenda 2030 Agenda for Sustainable Development. The agenda is a plan of action for people, planet, and prosperity. That sounds like worldwide health studies. Yeah, that sounds like what our de Villa lady is up to. We recognize that eradicating poverty in all its forms and dimensions, including extreme poverty, is the greatest global challenge and an indispensable requirement for sustainable development. Indispensable requirement for sustainable development. Indispensable requirement for sustainable development. What is sustainable development? I mean, does anybody even know? Do you guys know? Do you know what it is? Sustainable development? Well, this is an indispensable requirement to get that done. All countries and all stakeholders acting in collaborative partnership will implement this plan. We are resolved to free the human race from the tyranny of poverty and want it to heal and secure our planet. We are determined to take the bold and transformative steps which are urgently needed to shift the world onto a sustainable and resilient path. As we embark on this collective journey, we pledge that no one will be left behind. The 17 Sustainable Development Goals and 169 targets, which we are announcing today, demonstrate the scale and ambition of this new universal agenda. They seek to build on the Millennium Development Goals and complete what these did not achieve. They seek to realize human rights of all and to achieve gender equality and the empowerment of all women and girls. They are integrated and indivisible and balance the three dimensions of sustainable development: the economic, social, and environmental. The goals and targets will stimulate action over the next 15 years in areas of critical importance for humanity and the planet. Sounds wonderful. It sounds great. What's Canada's particular part in this? Canada takes action on the 2030 Agenda for Sustainable Development. In September 2015, Canada and all other 192 United Nations member states adopted the 2030 Agenda for Sustainable Development at the UN General Assembly. This initiative is a global call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. The 2030 Agenda presents Canada and the world with a historic opportunity to positively shape how societies of tomorrow grow and develop sustainably and inclusively to the shared benefit of all. If you remember Trudeau talking on last Friday, September 25th, about his role in what they're doing at the UN and the action plan for COVID, and how it gives us an opportunity to do all the things that we have failed as a global community to tackle. Oh, he's just so tough and strong. I just love everything that he's doing, and it's not duplicitous at all. It's 100% right in your face. They're telling you the truth. Everything that he's telling you is the truth, and it's not about climate change. Well, I mean, it is about climate change. So there's the SDGs and blah, 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 blah. When was this from? Oh, let's see. July 15th, 2019. This is when they're telling you about all this wonderful stuff. Oh, look. Join the conversation. I know that lady. In fact, she's from my city, Karina Gould. What does she think?
We stand at a tipping point. There are 10 years to go to reach our goals and propel this planet toward a brighter future. The stakes are high.
Oh, are they?
We face the perils of poverty,
global
pandemic, political upheaval, and the climate crisis.
Oh, well, that's
but
really
there is a way we can recover, inclusively and sustainably. The 2030 Agenda and the Sustainable Development Goals provide a path to greater peace, prosperity, resilience. Healthy oceans, secure food supplies, equality among all peoples. Canada is committed to taking action, committed to international cooperation, and to helping build a future that no one left behind.
Committed.
Join us, and let's hashtag turn it around together.
I was going to say something nasty, but I'm going to keep it clean. Agenda 2030 is going to do is start a war. That's interesting. So that's what's going on. The Sustainable Development Goals. And you can go read this stuff. It all is just so wonderful and just so easily achievable. Everybody knows that. Actually, we were headed in the direction to achieve all of this stuff before we had to shut down our collective economies and lose our jobs and give up our futures and actually give up any autonomy we had in deciding how we should approach our lives and our future. Instead, it's all going to be decided for you from now on. So you're going to get universal basic income if you're not part of the team that's implementing the plan to save the world. And you're just going to have to follow all the things that they say. You can't, I mean, like, look, you don't want to have to be re-educated. You don't want to have to make them do harsher things to you, like shut down your economy and take away all your stuff. But they're going to anyways. I mean, they're going to anyways. That's just what they're doing. So let's just see. What did Theresa Tam say? Who's Theresa Tam? August 25th. More needs to be done to convince reluctant Canadians to get COVID vaccine, Dr. Tam says. And none of this is about that, by the way. None of this. Every concern is a valid concern, and we need to address them more in detail, especially as we are working hard in the provision of a safe and effective vaccine for all Canadians. All Canadians. I put that in. She just says for Canadians. You know, no thank you. Guys, please go upstairs.
But we can't take ghouls and ghosts out of the TV.
Okay, give me 5 minutes, okay? Please.
No!
Oh. So basically, look. Her concern is that not enough people are going along with the plan, and that was in August. So how are we going to convince people? Who is Theresa Tam? Wikipedia. A Canadian physician and public servant who currently serves as the third Chief Public Health Officer of Canada, initially acting in the role following the retirement of her predecessor, Gregory Taylor, in December 2016. But let's get into her career. Tam, a pediatric infectious disease specialist, was Assistant Deputy Minister of the Infectious Disease Prevention and Control Branch at the PHAC. She's a co-chair of a 2006 federal report on pandemic preparedness in the wake of the SARS outbreak in Canada, which envisioned a respiratory infection pandemic that was described in the Globe and Mail as foreshadowing the 2019-20 COVID pandemic with eerie accuracy. Oh, yeah. It's pretty eerie, isn't it? By the way, the opioid crisis, which cost over 2,500 lives in Canada in 2016, could be higher than 3,000 in 2017. The current trend continues. I guarantee it's going to be higher this year. So she's really concerned about that. But don't worry, because here's the way Theresa Tam thinks, okay? Once she has everybody in check and she can control all things, she can abolish opioids altogether, and that will save lives. Do you see how this math works? Tam is on the Independent Oversight and Advisory Committee of the Health Emergencies Program of the WHO. Are you seeing a trend here? A role she took up between April and June 2019. She's an official advisor to the WHO's International Health Regulations Emergency Committee on 2019 COV2. On the 7th of January 2020, when it appeared that there was a health crisis emerging in Wuhan, Tam advised Canadians, there has been no evidence to date that this illness, whatever it's caused by, is spread easily from person to person. No healthcare workers caring for the patients have become ill, a positive sign. As of at the end of January 2020, Tam said, no reason to be overly concerned about COVID-19. On the 23rd of January, Tam was a member of the WHO committee that broadcast that it was too early to declare a public health emergency of international concern. On 26th of January, Tam stated there is no clear evidence that this virus is spread easily from person to person. The risk to Canadians remains low. Yeah, it still is. It still is, by the way. You can have all these plans in place and you can blow this thing up in concert with the WHO and the CCP, and you can panic people, okay? And panic in and of itself causes problems. But then you implement all the policies that you want to do, because if you are doing something for the greater good, which is what she thinks she's doing, then it doesn't matter. I will say this again, it doesn't matter. You have to crack a few eggs to make a totalitarian omelet. See how she's going to get rid of opioids? She's going to get rid of alcoholics. She's going to get rid of cigarette smokers. She's concerned about all these things. But the way that you're going to do that, you see, is make it impossible and illegal. Don't believe me? She was one of the ones telling people everything was fine. And now she's one of the ones telling people that even though the evidence is completely against there being any deadly disease happening right now, she's doing the exact opposite. She's inflating the panic and fear. She's part of this. the Global Action Plan, which I discussed yesterday in a video. This stuff's all here. This is the Global Action Plan, which they want to implement over the next decade, that Gould was just talking about, Karina Gould was just talking about. But let's actually look at some of the data, shall we? But first, I want to add this little nugget. It was an interesting piece that was in the National Post yesterday. Leslyn Lewis, there is a socialist coup unfolding in Canada, and we, the taxpayers, are funding it. Well, that's a wild claim, isn't it? Under the socialist revolution, there is no need to confiscate your property. They can simply redistribute your wealth. Huh. Canada is quietly going through a socialist coup. If I had written these words just 1 year ago, it would have been deemed conspiratorial, but I have heard from too many Canadians over the past 6 months about what they have seen taking place. Ever since Justin Trudeau tried to grant himself king-like powers at the beginning of the COVID crisis, what we have been witnessing in Canada is a socialist coup that we, the taxpayers, are funding. Yep. With the $343 billion deficit, Canada has started on a perpetual debt scheme reminiscent of Argentina. But don't worry, okay? Because what's going to happen is all these countries that have borrowed all this money, they're going to fail. Their central banks are going to fail. None of this stuff was meant to work like this. You can't just print money. But since they're all going to fail, they're all going to say, we need to have a better new solution moving forward, like a world government or something, with funds as doled out by the World Government Bank, and we'll just give everybody universal basic income. It's going to be worldwide. It's going to be about equality and inclusion. How do you think they're going to achieve the 2030 Sustainable Development Goals? Because the plan is to give everybody the same thing. And then for the controllers get to do whatever they want as long as they go along with the plan. They'll get flying taxis, and they'll get wonderful homes, and they'll be all like, zero net energy. It's going to be all the sustainable. But they're going to control everything. The only way they can do it is that they control everything. And that's socialism. So does socialism ever work? Oh, the Scandinavian countries. You don't know what you're talking about. You don't know what you're talking about if you say that. I'm not going to go into it today, but you don't know what you're talking about. Even more concerning is that COVID relief has ballooned into non-health related issues like favoring green energy initiatives, which are rarely actually green, over natural resource development. The lack of transparency in government has raised concerns about unexplained inconsistencies, including adding new rules that made it difficult for smaller retail and grocery stores to operate, but allowing larger outlets to function, cracking down on places of worship but not on protesters, and limiting, depends what protests you go to, and limitations on family gatherings to which politicians don't adhere because they can do whatever they want. They're part of the implementation team. You're one of the pawns. You're one of the people to be moved around to get this socialist paradise going. All of these unanswered questions raise queries about the hidden agenda behind providing a guaranteed income of $24,000 per year to able-bodied working-age Canadians at an annual cost to the taxpayer of $464.5 billion. Totally unsustainable. We've committed hundreds of millions of dollars to helping other countries fight COVID-19 while still having insufficient testing for Canadians. Moot point. Basically, we're all kind of like, if Canada has more than a developing country, then we give more and they give less, and that's about equality. It's about Agenda 2030 equality. This is ideology in full display. They took over all the institutions, and now they're doing exactly what they wanted to do, and they're telling you they're doing it, and they're telling you it's because of a pandemic, but really it's because of climate change, and it's because it's something they needed to do. They will tell you that openly and honestly. Prime Minister Justin Trudeau did so on Friday. Go look it up. Look at the address he gave to the UN. I posted it in a video that I did yesterday. We still lack proper supports for small businesses and farmers to get through the pandemic, and we are essentially threatened that if we do not support the unjustified spending, all government support will disappear. Yeah, it's a carrot and stick game. But it only lasts so long, just so you know. See, they're gonna offer you these things to go back to your normal life, but they're never going to give you back your normal life. If you worked somewhere that wasn't in a government-sponsored type plan or wasn't working in concert with government decrees and doing everything by the book and making everything about equality and this and that, and like, This has always been a plan to bring down capitalism, period. Period. Now, you can have whatever you want to say about capitalism, but capitalism allows people to engage in the world in a way that they see fit and to make decisions in their own lives as they see fit. It's a cost-benefit analysis. And that's how you get some people that are successful and some people that are not. And unfortunately, that ratio has been going from where it was, where there used to be middle class, to now there's the haves and the have-nots. And that's a function of actually mostly socialistic policies. The idea that in Canada you have healthcare and that's like this wonderful thing, and it's only like a huge part of your taxes, you don't understand. If you took the same amount of money in Canada that you pay on your taxes for your healthcare, and you were to buy a healthcare plan, it would cost you way less. And that's all you need to know. And it would be better. You would be in control of that policy. You would decide who you want to go to. That's a market. They're taking all that away. And they're going to offer you, since they're destroying all economic productivity around the world, and they're putting everything under top-down control, and the way that you act actually depends. It depends how far you're going to get high up that chain. If you adhere to all the rules and conditions that they want, believe all the same things they believe, you will be part of the club, and anybody that disagrees with it will be deemed an enemy of the state. They will be treated like garbage. Are they garbage? Doesn't matter to an ideologue. An ideologue has decided who's good and who's bad, and now they're changing the world to fit what they think is right. They don't care. They don't actually care. They decided this a long time ago, and they're doing it now. And people aren't paying attention. Under the socialist revolution, there is no need to confiscate your property. They can simply redistribute your wealth through a home equity tax, confiscating hunting firearms that were legally purchased and owned, increasing. Why would they want to take away firearms? Because guns are so bad. Guns are bad. No, guns are the only thing that you can use to protect yourself against the government, and they saw that as a threat, and they want to minimize threats, so they want to take away guns. So this is what's been going on all along. When you give away your guns, governments take over your lives. That's why they have to destroy the United States with all this racist bullshit. I mean, it's total nonsense. The world is not more racist than it was 50 years ago. And this is about creating the conditions for martial law to take away guns from otherwise good people. You don't believe me? What is going on right now? Do you see what's going on right now in the world? Are your eyes open yet? Oh, they're going to take your savings and blah, 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 and give it to people that need it more than you do. So what do we actually know? Here's the most recent report from Public Health Ontario, ending October 2nd, excuse me. There's been 2 increased deaths from one day to another. Sounds like a really scary thing to me. Who's mostly getting sick? So this is just changes. This is like the number of cases in the last couple of days. So 19 under actually went down from 107 to 99 from the one day to another. 20 to, now you could say there's a lag of reporting, fine. Okay. 20 to, but what we're looking for is a spike here. We're looking for a spike. 80 and over, less. Well, those will probably be reported later. Deaths are down. Well, they're just not reported in time. I really want to get down to these graphs here. Confirmed cases going up. Number of cases here. Look at this. You got 450. Over here, I want you to notice that at the peak, we had an average of 600, and that was in April. It went all the way down, and now it's going back up. What is causing that rise in confirmed cases? Number of COVID tests completed in percent positivity. Notice this. Back here, they were designated COVID cases and deaths based on presumed COVID. Okay, so they were counting all these people that were dying from presumed COVID. Meanwhile, the tests, they didn't even have the tests. See, tests way down here, presumed positive. Test down here, presumed positive. They did it again here. Went all the way down. Okay? Presumed positive. Even now, we're having 600 tests, 400, and they're doing thousands, tens of thousands. I want to point something out along that for you. This is confirmed deaths. And look at that. Here, there was a spike. Okay? The end of March, April, all the way down. There's like, look, does this look like, oh my God, we're about to, does this look like it's going to do this again? Does it look like that to you? So how are we getting, by the way, if you look at the numbers, deaths reported 19 and under 1, I would call that highly questionable. 20 to 39, 11, all of those are suspect. 40 to 59, 124, all of those are suspect. These are highly sick people with big time comorbidities, unfortunately. There are sick people out there. And there's other reasons. I mean, I don't know about here. I know in the United States, if somebody dies with a car accident and they're given a COVID test and then they die in a car accident, they call them a COVID death, which is insane. But they are doing that in the United States because this is all about massaging the narrative. So look, vast majority over 60. There has been almost no deaths in people under 60. As a percentage of the population, we're talking 135, 36. 136 deaths. 35 million people. Are you scared? Even if you take the full number, it's like nothing. It's nothing. I told you 780 people die every single day. How many days is that? Okay, 3,000? What? 7? 7 days worth of deaths? They can't massage those numbers? Come on, wake up. But it's going to tell you some breakdown of the stuff. But I really wanted to draw your attention to this one particular thing. Well, let's go right back here. I'm almost done. Thank you for bearing with me. Tests going up. Let's look in August here. They're really low. And they started to creep up. What changed in August? Well, sorry, let me find this. Oh, there we are. Data caveats. Only cases meeting the confirmed case classification as listed in the MOH and the COVID-19 case definition are included in the report counts from CCM+. This includes persons with a positive detection of serum plasma immunoglobulin antibodies to SARS-CoV-2, which was added to the confirmed case definition on August 6th, 2020. So now they changed it from people that are they're active cases to we're detecting antibodies, which means that you're not sick. It means you might have been sick at some point. It does not mean you are an active case, but they're including you in the active case numbers. Why? Why are they doing that? If I got that wrong, somebody tell me. And so what did our friend here say? Right. About the UK. They got a spike. Daily new confirmed COVID deaths per million people. It goes right up to October 3rd. Let's take a look at the UK. Oh, look at that. March through April, there's a huge spike of people that they're calling dead from COVID, and it goes all the way down and pretty much stays down. And there's a little tiny blip at the end. Does it look like we're entering a new terrifying pandemic that we need to shut down the world for? The only thing that has happened here is that people have lost their minds and they've put ideologues in control. Right. I'll believe that when I see it. What do these people want? They want to fix their global action plan success goals. This was released in 2009. I think it was July 2019, something like that. Principal measure of success under the Global Action Plan is the achievement of the health-related SDG targets by 2023, the midpoint of the 2030 Agenda for Sustainable Development goal. The plan will have brought about 3 major changes: better coordination among the agencies and their global, regional, and in-country support to countries, a reduced burden on countries as a result of better aligned operational and financial policies and approaches, and a purpose-driven collaboration that is integrated into the agencies' organizational cultures, encompassing leadership at global, regional, and country levels. That's fun to say. Regulatory capture. Well, what does that mean? That means when a company becomes so big, or an industry becomes so big that it has lobbyists that go to Washington or wherever in whatever country, and they talk to people and they talk to lawmakers and they talk about all the things that need to be done when it comes to oversight of their particular industry. The Global Vaccine Action Plan, launched in 2011, sets out goals and objectives for the immunization community of the decade to 2020. Its vision was of a world in which all individuals and communities enjoyed lives free from vaccine-preventable diseases. The Global Vaccine Action Plan, developed by the immunization community and endorsed unanimously by the global health community at the World Health Assembly, set ambitious goals and targets to catalyze a concerted global drive to minimize the burden of vaccine-preventable diseases in every country. Now we're saying the cold is a vaccine-preventable disease. You're welcome. Global immunization partners, WHO, Gavi, the Vaccine Alliance, and the Bill and Melinda Gates Foundation, UNICEF, and the U.S. National Institute of Allergy and Infectious Diseases pledged to work together and with other immunization stakeholders to make this happen. Immunization stakeholders. Regulatory capture. The very big pharma companies that are producing the vaccines are immunization stakeholders. The Global Vaccine Action Plan includes 5 goals and 6 strategic objectives. A set of specific indicators and targets was developed to support monitoring and evaluation, with progress reported annually through a comprehensive Secretariat report and the summary assessment report. Reporting on research and development indicators takes place every 2 years, including this year. That's Gavi. That's what Gavi is. There will never come a point at which immunization is no longer required. There will never come a point at which immunization is no longer required. Every year, more than 130 million new babies are born, each equally deserving of protection against vaccine-preventable diseases, say the partners. Exciting opportunities exist to extend the benefits of immunization to additional age groups. Are you getting this yet? Exciting new opportunities. Additional age groups. If you didn't get your shots before, or you're not up to date on your schedule, which is going to change very soon, trust me, you're going to get your yearly flu shot, you're going to get your yearly cold shot, sorry, SARS, cold, whatever it is. And it's going to change every single year, and you're going to have to get it in order to engage in society, because you're going to be under universal basic income that's going to dictate that you have to do that because a bunch of socialists have just taken over the world, and we're all sitting back while they do it. They're destroying businesses that took years to build up and will take years to rebuild. And in the meantime, the world economy is going to crumble because of the actions of our collective governments borrowing money they never had any intention to repay. Exciting opportunities exist to extend the benefits of immunization to additional age groups and to introduce new vaccines and vaccine delivery technologies. Hence, as the decade of vaccines draws to a close, the new plan is needed to guide countries and immunization partners through the next decade, starting in 2020, to ensure continuity, Development of a new strategy needs to begin before the end of the decade of vaccines in 2020. What do you think that strategy was? Event 201, much? Hence, as well as reviewing progress against global vaccine action plan targets and objectives, this assessment report also just suggests a pathway towards the development of post-2020 strategy, building on lessons learned during the decade of vaccines. So they learned how to screw with your ability to understand. They learned how to propagandize you, and they learned how to take over the institutions from within by getting everybody at the WHO to agree to the plan and what was necessary in order to implement it. Does this seem like socialism to you? It's under the guise of socialism, but it's a lie. And all the ideologues that are taking part in it that think that they're doing it for social justice purposes are morons. They're absolutely being used. They're useful idiots by giant corporations, big pharma, and Bill and Melinda Gates, and all this handful of ridiculously rich people who could end world poverty and hunger tomorrow if they wanted to, and wouldn't have to worry about that. If you have healthy people and you give them a healthy education and you give them the right set of goals and the right set of things to work toward, and you stop telling them they all deserve something from each other. Instead, tell them, you know what, take control of your own life. Be a good person. Here's what you should engage in. Enough with all this stuff that's meant to distract us. By the way, I'm going to do a report. I'm going to do another video. I'm going to read to you from the book of people that designed the education system to stupefy the entire Western world and make them into good little workers so the rich would be able to take control of all of the resources and all of the things that needed to be done, and they would be the ones controlling, and they're going to tell everybody that you're a stakeholder in this world. It's garbage. They want to control all the things and all the resources, and they think that if you have any power, you're going to screw it up. They're taking away your power, and you're sitting back and watching it happen. So, all I'm saying is, call me crazy if you want, but if you consider the possibility that a group of elite bankers promoted communism across the world for their own devices and merely exploited the human tendency to blame everyone else for their problems by managing crises, what do you make of that? That's one of my own personal memes. Do you like it? I thought it was funny. Where are we now? Humanity was on the cusp of the largest prosperity and freedom from corporate malfeasance via open source intelligence ever, because all the information was coming out about the actual damages caused by vaccines. And people were fighting back and they were demanding some kind of justice, whether they were misguided or not. You see, there's always been pushback against the system. There's always been pushback against the rich elites that wish to control all of society. What you needed to do was guide it into the right places that it wouldn't affect the overall plan. In fact, it could enhance the possibility of making the overall plan come into play. 2030. Right when the virus enabled a control grid that is solidifying the necessity to turn people into meaningless cogs in a giant machine. They're taking away your ability to engage on your own terms. This is from Rocco Galati. I highly suggest you check out what he's doing through the VCC. He has filed a lawsuit against all the actions of the government, and in concert with the partners, the stakeholders, the regulatory capture boards of Big Pharma and various other large corporations, Amazon, Walmart, all these type of places. They're all going along with the plan. They're not fighting it because they end up winning in the end, and all the small guys end up losing. And it doesn't matter if they've actually been able to look at where this is going in the future. They do know that they'll be fine. And I'm talking about the corporate boards here. They know that they'll be fine. And in their belief system, they're doing something that you can't stop. And so you might as well go along with the plan. You can't beat evil, join it. So this is from the lawsuit. There's a declaration that the declared rationales and motives and execution of COVID measures by the WHO are not related to a bona fide nor an actual pandemic and declaration of a bona fide pandemic, but for other political and socioeconomic reasons, motives, and measures at the behest of a global billionaire corporate and organizational oligarchs. And that's 100% on the money. And I suggest you check out Rocco Galati. And that's it. I'm done for today. I hope you all have a great day. Love you. Don't let these people do this to you. They're lying to you. they have an ulterior motive that might sound good, but it's just about controlling you and not letting you live your life the way you want to. And I'm not okay with that for me and my kids. I'm sorry. This is actually unbelievable. This is going on and people are just sitting back and watching it happen. So I love you because I want you to have freedom. These people do not think you deserve it. You choose who you want to listen to.